the speed videos because they provide very concise information. So I went through, and that was very helpful. You need to do to crack those MCQs. So first you give a grand test too. So I gave a grand test to understand where I stand. So
Okay.
I was able to do rapid revision from speed. That was very helpful.
So I bring in all the wishes and greetings on behalf of all the faculty members of Speed Medical Institute to Dr.
Thank you so
Shrestha
much.
Ghosh for scoring a topmost rank of 45 in DM Respiratory Medicine Group. Congratulations to you.
Thank you so much. Thank you so much. Thank you.
Great. So can we know your brief background from where you started till date? Before that, I want to thank you for sparing your time to share your valuable experiences with us and also to the students who are watching it.
No, thank you so much for having me, sir. So I did my MBBS from RG Kaur Medical College, Kolkata. I joined in 2015, and then I joined DNB in respiratory medicine from Indraprastha Apollo Hospitals in New Delhi in 2022. And my course ended in November 2025. And after that, I gave the SS exam in December 25.
Excellent. Once you decided to do a super specialty in DM pulmonary medicine, what all the strategies you used, how you prepared, what was the preparation strategy that helped you to get the rank that you are in today?
Uh, Sir, actually, when I got into DNB, I had it in my mind that I wanted to do DM after this. So, but workload is a lot, so it's difficult to actively study when the exam is very far. It's after 3 years. But actually, I try to focus a lot on clinics. So whenever I would see a patient, it's an everyday exercise that you see a patient, you go home and think about that patient, you read about it, and our faculty was also always like, you have to do evidence-based medicine and you have to know the guidelines. So it was a regular exercise to keep myself updated with the guidelines, read the guidelines multiple times, read the textbooks as much as possible, and also see videos because that provides more concise information. And towards the later half, it's more of revision, as much revision as you can do. And actually we study very intensely during the third year because the DNB exam is extremely difficult to crack in one go. So a lot of extensive studying during the third year, and that forms the base to go forward.
Great. Now, once you decided to do so, how long you've been preparing through this? What all you did to go on to get and make it today?
So my major preparation was in third year itself of my DNB. And I think, and more seriously after my tenure got over, because before that my exams were only going on. The first thing that you must do, I think, is to give a grand test, because the grand test tells you where you are exactly and how much more you need to do, because the DNB exams themselves, they prepare you quite extensively with the material. And then after that, you need to know how much more you need to do to crack those MCQs. So first you give a grand test too. So I gave a grand test to understand where I stand. And from then on, I recollected the information that I already knew and studied more specifically. And just before the exam, the speed videos, because they provide very concise information. So I went through those in the last, and that was very helpful.
Great, doctor. Thanks for sharing. Can you tell us how many questions you were able to answer this exam? Can you share some about this paper? What do you feel about it?
I answered 145 out of 150. It is always the dictum that you try to answer as many as possible, leave as few as possible. And there was a lot of, I felt that this paper had a lot of focus on clinics. So you should not neglect your clinics during the 3 years of your PG course, because it depends on how many patients you see, how many x-rays you see. There were a lot of x-rays and a lot of histopath also in the paper. There were CTs. So they asked a lot from those. Also, they had uh, in addition to that, pneumoconiosis, occupational lung diseases, there were a lot of practical topics, and also critical care based topics, more focused on respiratory, were also there. So quite extensive, but again, practical oriented mostly.
What will be your advice for the future aspirants of DM Pulmonary Group?
I would advise that you start preparing from your PG days only, because it is a culmination of your 3 years, and you have to be sincere in your studies during those 3 years, because otherwise, after that, the road is quite uphill. So I think preparing from the first day, and uh, clinics, while they're important, you should know the theory behind the clinics. Always going back and understanding why we do the treatment that we do and how that benefits the patient, what more we can do, what are the latest guidelines, latest trials. So all those things will, ultimately, they will help in you giving a good exam on the day of the on the penultimate day. So
Great.
regular studies is required, and of course giving the grand test, because before the exam you need to give a grand test, a few grand tests at least, to understand where you stand. So that's very important.
Very nice. So who introduced speed to you, and what was the experience of speed for this exam for you?
My senior actually introduced me to speed, because many seniors in Apollo, they do take speed. So actually, I took speed few days before my SS exam, thinking that I will target the next year's exam in 2026. So
Okay.
I was able to do rapid revision from speed. Um, but and my target was the 2026 exam. So
Good that it will be completed in 2025. And
yeah,
2026
yeah, it
for
was.
a super specialty person.
Yes, sir.
Very good for you. Good, good, good news. Happy to hear. And time to thank, and whom all you want to thank. You feel that they helped you from day one till date. You can use the platform to thank all of them.
Yes, I would definitely thank my parents. They have been a huge support. And I want to thank my husband. He's also a pulmonologist, and he, helped me through strategizing for the exam and everything.
Very
So,
good. Very good.
yeah,
So two people who
thank you
are
so much.
pulmonology.
Yes, yes, sir.
Very good. Congratulations to both of you. And once again, we wish you all the best and all the success for a great, great and wonderful career in DM
Thank you so much, sir.
Specialties.
Thank you so much.